Hi, I'm Sarah Myers. I'm the Child Care Health Consultant with Child Care Aware of North Dakota, and today I'm going to be talking about masks. And first of all, I'm going to be talking about why and when adults should wear masks. First of all, I just want to make it clear that masks are not required for child care settings for adults, but they are recommended. And why they're recommended is because of these reasons. For one is that they stop droplets. So when you cough, sneeze, talk, sing, droplets come out of our mouth, and therefore that can spread the illness of COVID. Also, adults are more commonly the ones that do have COVID or get cases of COVID. So that's why we would like adults to wear masks. The other thing that I've been asked before is if you wear a mask, what's the benefit of wearing a mask? Even if we have to close or we have to have children or staff excluded, why would I still need to wear a mask? And just to make that maybe a little bit more clear is that unfortunately, wearing a mask doesn't change the criteria, meaning if you're a close contact, because whether you're a close contact, that means you're within 6 feet of another individual with positive COVID for 15 minutes or more. So that would be, you're still a close contact whether you have a mask on or you don't. So therefore, you would still need to quarantine for 14 days, whether you were around someone that did have a mask on or not. The benefit would be is that you may not have spread that illness to the other staff members or another child if you did have your mask on. So while those children and staff may be out of childcare for 14 days, they may not develop the illness. So you there would have prevented or may have prevented them from getting the disease of COVID. So there is definitely a benefit. So when should adults wear masks in childcare? Well, for parents and visitors, for one thing, we would want them to limit as much as we can from them entering your home or your facility at all, just because that limits those contacts coming in. However, there are cases that might not be preventable. If the visitor, be a therapist or somebody has to come into your child care setting or a parent has to come into the child care setting, what we just are recommending is that those individuals would wear a mask once they enter your home or the facility and wear that mask throughout the time that they're in your home or facility. So next I'm going to talk about staff. So staff should wear a mask anytime they were within the program facility, in a classroom or any area where they are within a close distance of within 6 feet, that would mean, of a child or another staff member. That's when they should have a mask on. If your staff or if you typically eat with the children, that might look a little different, or what we're thinking would work better and what is recommended is that you keep your mask on and that you wouldn't be eating with the children while you're sitting at the table. We still want you sitting at the table because I can't stress enough the supervision piece. That is high risk activity is eating. Eating is considered to be. So we want you to stay there and we want you to be within close proximity of them so you can help, like I said, supervise as well as help assist them with their eating. However, could you please keep your mask on during that time so you wouldn't eat with them per se at that time? Could you eat at another time? So maybe when you're out of the classroom, you're in a break room, another time where it's maybe where you can physically or distance 6 feet away from another staff member or another child. That would be recommended if you can do that, instead of eating, like I said, at the table with them. Another time that you could definitely take off your mask, if you're wondering, when can I take off my mask? When I am in a child care setting. Obviously, if you go to the bathroom, we want you to be able to feel like you can go to the bathroom without your mask on. If you've left the classroom and you're in a break room or you're in another area where there isn't anybody around you, or maybe you know you can socially distance or physically distance, 6 feet away, definitely you can have your mask off. So those were times that you can. Another time that I was just thinking about maybe that it would work is if you're in a classroom during nap time. Because obviously what might work is that you have your mask on when you're rubbing backs or you're trying to settle those children down, so because you're going to be close to them, so please keep your mask on at that time. But then let's say all the children fall asleep and everybody's sleeping, so that You could move 6 feet away. You could be, at a place that you could take your mask off because you're 6 feet away from other staff or other children. You're still in the room supervising, but there, you wouldn't be at risk then to the other children or other staff members. And then, of course, once they do wake up or they're starting to wake up and you're anticipating when that happens, then put your mask back on just so that you do have it on if the children need you or another staff member comes close to you. So that could be another time you give yourself a little break if you need to take your mask off for a while. So when it's not feasible to wear a mask, so obviously there might be those times that it's not. So times that I think about that, like I said, if you're within close contact of somebody, meaning within those 6 feet, please wear it. However, there might be times, like I said, that might not be feasible. So one thing I thought of would be if you're maybe an infant room teacher and you have obviously little babies that you're cuddling, holding, and then they tend to, when something's new on someone's face, especially new, they tend to want to grab it, touch it, dig under it, try to take it off. So you might find that that would not be maybe the benefit you want, just because it's not going to provide you the benefit that you want, because all these different children are touching it, maybe touching your face more so than they ever did before. So therefore, you might find that that might be a source of spreading more germs than helping you prevent the spread of germs. So that might not work, but try. You can always try and see how it goes, but it might not work. Another time that might not work is if you maybe are with young children and they are scared of masks, where you're finding that you don't look like Sally to them. So all of a sudden they're scared and they're crying and they're just reacting really strongly to someone wearing a mask. That might not be where I said the benefit might not outweigh the risk of you wearing a mask. However, I think we all know too, it might be that children are becoming more normalized to this, seeing masks, because they're starting to see them, and maybe their parents wear them, maybe their grandparents wear them, and they're not bothered by it. We can all know that some children do really well and some children do not. So you might find, just see how it goes, but that might be a case where you might want to say that that isn't working so good. Also, if a staff member has maybe a special condition such as asthma, or maybe has a sensory disorder or is anxiety or something that they are really struggling with. So on a normal basis, and then all of a sudden they're supposed to be expected to wear a mask all the time, and that might be something that may worsen their condition. And you might find that that's maybe not feasible. So if you're ever questioning that, or if your staff are ever questioning that, it is recommended for that individual to reach out to their healthcare provider and just have that discussion with them and see what their suggestions would be, and you can always get a written order, instructions of whether or not a mask should be worn, if that's something you're required to wear in your setting, so that way you get a little bit more information, and you also get the information from their healthcare provider. So that might be a helpful thing to do. Other thing would be high heat. I think all of us know that we're in summer and we actually are having heat and having hot days. And on a normal day or on a normal summer day, outdoor play is not recommended if the heat index is 90 degrees of temperature or considered to be a 90 degrees Fahrenheit heat index. So like I said, that across the board, doesn't matter when it is, that's when we recommend outdoor play is not recommended, just because even if you weren't wearing a mask, it could be high risk for heat-related illnesses. So you think about if all of a sudden you put a mask on, that could really affect your breathing, or it could affect maybe the chance that you're overheating even more, so you might be more at risk for a heat-related illness. So just be very mindful of that if the temperatures are high, and see how you're doing. And then obviously, if you're outside, is that obviously sometime you wouldn't need to wear a mask, and you would just put it on if you needed to be within close proximity of a child or another staff member. However, still, I always want to stress supervision, that we want to make sure that you stay close by, because that's what we want you to do, to keep the children safe, so that you're always watching what they're doing and you know where they are. So we always want you to stay close by, but just that would be a time, being outdoors is usually obviously less risk than being indoors of germs being spread. And then you could social distance or physical distance a little bit more easily from the children, and while you're still providing supervision of them when they're playing outdoors. And then the other time would just be obviously as if a situation ever occurs where a staff member all of a sudden has difficulty breathing for whatever reason, or for some reason becomes unconscious, which obviously would be an emergent situation where you'd call 911 anyway. But if that person was wearing a mask, that would be something obviously you'd want to remove right away for that individual, just to help them if they can't do it themselves, just to make sure that they are able to breathe the best they can, obviously, in that emergent situation. I do want to remind you all that please know if you have any questions about masks or any other issues around COVID or any other health and safety issues, please know that Child Care Aware is here to help you. You can contact our health consultant, and we will help you either guide you to the right resource or answer your question.